feel free to use the chat. Also, we're like, this is new, right? So if those who are out in the great internet cannot hear us, like, then just say something, and we can kind of make sure that we're, and also, as I am like ever growing my role as facilitation, this is like the newest thing where I don't want to prioritize the physical people who are here and not just the virtual. So I wonder if Angela, can I see the people on the screen, and is that my thing that I have to do? I think you can. Is that just me? Yeah, I mean, oops, so. Perfect. Well, that's participants. How do I like see the other people? Do you see them up here? Oh yeah, I see you guys. Okay, great. Okay, so the goal of this is really building the capacity for dialogue. You know, we talk to our friends, we talk to our family, we talk to our colleagues. This is really about, we don't know who's joining today. And so feel free to introduce yourself in the chat, or just as we're talking, introduce yourself, you can bring a little background. But really this is about like, how can we spend this hour talking about a scenario, a question, and kind of share knowledge, but also continue in the question stream. So my challenge to everyone is that as we're conversing here, that you try to end your thought in a question, right? So you can share your opinions, we can share our knowledge and our thoughts, but really thinking about ending this, the statement in a question that continues the loop on. So we're really building what our questions are. At the end, we have more questions than answers. This is my comic that I found that I love. I'll let you look at it, kind of just really thinking about the true quest is the questioning. Does anybody want to add anything at this point? Cool. So you're like, cool, what are we doing, Maya? This is great. So the theme of MedTech, as was proposed to me when I started, I was like, so I'm an educator, a STEM educator, so like I know some things about medicine and some things about science, but when MedTech, I was like, I have no idea what MedTech is. So I don't want to spend the whole time defining this topic because people have done that before, and also that's not the way you start a presentation. But I do want to just clarify MedTech, right? Generally in my communications with other more MedTech-minded people, is really thinking about hardware, those devices, digital health, and MRIs, MedTech, I didn't know that. And thinking about life sciences generally as biotechnology. These are regulated hardwares and softwares. MedTech is not, I just learned this, Fitbit and any of the health apps on your Apple Watch, because those are unregulated, right? This is a community conversation. So a toothbrush is a medical device. A toothbrush is a medical device, right? It aids us in our dental hygiene endeavors, right?
You have to get approval to make a toothbrush.
Yeah, but you have to follow standards.
That's true. Yeah, I guess you can just go rogue and
But
just
the
make
Apple
your
Watch
own brush.
doesn't. That's not true. Measures your heartbeat. That's what do you have?
Well, so here's the thing, your heartbeat app, right? Things like that, those are not regulated. There's no, like, doesn't have to go through a regulatory process.
But a toothbrush does.
I think so. From the Medical Association, right?
So toothbrush is a class 1 medical device. You don't have to get permission to market it. Because your Apple Watch is not being used, unless it's being used by a clinician to diagnose or treat or prevent, then it's not regulated.
But a toothbrush is diagnosing, or doctor recommends it.
Right,
Then
dentist
says,
recommends everything.
use a toothbrush.
It's a class 1 medical device, so there are certain standards that it's exempt from or you have to follow.
Okay, good.
But anyway, so we could spend more time if you like. I like to start this conversation by having the group choose sort of which direction we go in. I have 2 scenarios, but if you guys want to spend the whole time talking about what is and what is not MedTech, we can do that. So this is what, I should go back before I get this one. I like to pose 2 scenarios of all the things that I've been like thinking about and talking about with people that are like the direction for the community conversation, and then we kind of just go for it, right? Share, ask questions. So I'm going to pose 2. Please, this is your chance. This is where the direction of the conversation goes. So if you want to type in the chat or share openly what you think would be a more interesting direction to hear from the people in this group, go for it. We will vote then, you know, this democracy that we're in. So the first question is, would you donate stem cells to organ research to prevent disease in others? This could mean growing an organ in a dish or in a body, for example, a pig. Okay. Second scenario. If anybody wants to add to this, you can. What would a healthcare system look like that was centered around social determinants of health? This is a big public health thing, but I think it's interesting to think as we think about the future of technologies in medicine and healthcare, kind of spending the time really thinking about like how we rethinking what it would mean for you to go to the doctor, go to the ER, right? Things like that, and thinking about it as encapsulated in this larger human life. Does anybody want to add another scenario that they think they're like, Maya, these are cool, but like, let's actually talk about this because it's more compelling.
Yeah, I don't really see that either of these are hugely about technology and MedTech. The first one, it's really about a biologic, and you can argue whether stem cells are devices or drugs. I would say they are devices, but whether someone would personally donate doesn't seem to be something that's community looking. It seems to be more ethics, more moral, personal preference. I would be interested in, I think that there has been, because of the pandemic, huge movements in the MedTech community in the way technology is used, and the openness, quite honestly, of clinicians to embrace more technology, more remote monitoring, more data sharing, things like that. It's also changed the entire way MedTech is sold commercially, because you don't have sales reps in the hospitals like you do. I think it's a tremendously dynamic time in traditional MedTech, as in medical devices sold to hospitals. And, you know, that I don't know who else is on the call. Maybe this is more focused on the interests of the community that's there, but that's my.
Right, sorry, can you just restate? I think that was, I appreciate your insight there. Can you, so in the more MedTech direction, more how technologies are utilized in medicine, is that?
Yeah, I mean, you know, here's a scenario. How do we think the COVID pandemic and this period of time where hospitals were so singularly focused and faced a whole set of new problems that they hadn't faced before, what are going to be the long-term consequences of that in terms of development goals, in terms of, you know, what technology is going to be embraced, and in terms of how technology is sold and adopted in the hospital? That would be, I don't know, you know, that's, I guess I thought more where this was going, you know, and maybe not specifically to the pandemic, but I think
yeah, so that's interesting. That's what you're bringing. I'm sorry, that's what you're bringing to this, and that's helpful. I mean, the ethics question is a huge piece in community conversations that we've had before, where it's like, what happens in your future, the future of your own healthcare and the choices that you're making? There are these ethical decisions that are based on the technologies that are around stem cell technologies, which, you know, when we're talking about MedTech broadly and life sciences being included, that's why we can have that stem cell conversation too. But
well, and I think what kind of building on what is your name?
Lisa.
Lisa, I can't see from here. Poor eyesight. You're spot on in terms of the way, you know, the COVID forced the healthcare system, the providers and the payers to look at telemedicine in a way to make money and continue providing care, because it was both. And I think this question around healthcare systems and technology and social determinants of health, I think there's an opportunity as things evolve, if we think about maybe not regulated technology, although that's certainly part of it, but how can technology build on the platform that we've really uncovered? Like, yes, it's effective, we can get it paid for, it helps patients have more access to care. Can we roll out new technology in neighborhoods, in different environments, for preventative measures, for kind of education around certain disease states, you know, and can that drive the economy in some of these underserved communities as well? So that's why if I stand back and think of real big picture of where the opportunities that COVID has given us, because of the point that you made, Lisa, right, of having new access, I think it becomes an interesting challenge.
So one question with that would be like, is there more access because of things like telemedicine, and instead of assuming, right, like has there been,
Yeah, I mean, it's one thing around like, is there more access? Recognizing that a lot of underserved communities don't have technology, like they don't have internet. And so, yeah, it's great that you can use telemedicine and, you know, you don't necessarily have to go in to see your provider, but if I don't have internet access and I can't afford, you know, a device, how do we address that as a community?
yeah.
Right, and so the infrastructure hasn't kept up with the technology in order for it to work for people who don't have access and don't have a comfort level with technology. And certainly the pandemic has surfaced that there are a lot of people like that. You'd have to have it be telemedicine, you know, from your CVS Minute Clinic, you know, that people can access more easily. That, you know, basically broadening services and some of the distributed healthcare models to be able to deal with more than strep throat and, you know, ear infections, you know, to deal, because they have telemedicine facilities there. But I agree with you. I don't think telemedicine increase access, except maybe in rural places, you know.
Yeah, well, let's stop there and just see. So there is like a whole group here. So it's like, I think that's a great scenario that we could push a little bit more and kind of see, really interrogate, like, did anybody have more positive experiences with healthcare in the past year, you know, than previously, and kind of build on that. Before we decide on one to kind of dig into a little deeper, are there any other scenarios that we want to throw out there? MedTech is huge, I would say. So, you know, any other thoughts from the room? Any other thoughts?
I think that mentioned the digital access, but in general, technology enables communication within the community and between the community and health providers could be very important. You know, in treating disease as something that affects the community as much as the individual. If one thing COVID has made clear, it ought to be that.
So the more use of technology and like from a public health perspective,
Yeah.
and zooming out a little bit from the individual.
Yeah.
All right, last call. Let's vote then. You guys can't see this, I think, probably, but I'm learning how we do this, so. So I guess in the chat, or just generally, like, you can unmute yourself too. Is there a preference for where we dig in? I would say, despite what Lisa says, I'm super fascinated by this question, because I think it actually does relate to a sort of a technology that has the potential to save lots of lives, which is MedTech in my opinion. But this is more of that sort of stem cell question, or really around like ownership. I actually would say this is more around ownership of your body, really, and at what point you sort of can really feel comfortable releasing it to science. Then the healthcare system and social determinants. And then I think the third one is really more around the telemedicine and access to healthcare, thinking about how these technologies do provide more access on a larger societal scale or individual scale. So 1, 2, or 3, what do you guys want to do? We got a 2. I'll write it right here. 1, 2, 3, go. What do you think? We got 3. Oh, that says 3. In the chat, you guys typing? You guys saying? I'm sorry. You're the only one, George, that I can't figure out how to read it.
No worries, I
You know what,
just
I can have the table
remembering
covered.
which, couldn't remember which is which.
Okay, yeah, so in the chat, 1 is more of like the stem cell donation, 2 is the social determinants of healthcare, what would that future look like, incorporating all those things, and then 3 is more about around the access to healthcare when we think about these new technologies that we've seen, like telemedicine, and we could also talk about other technologies that make medicine and healthcare more accessible.
Did you see Lisa's response in the chat? She said 3.
All right, let's go for it then. Looks like unless anybody, okay, all right. Okay, so let's go further. So,
Next time.
well, yeah, okay, so I'm not gonna look at this whiteboard anymore. So then let's chat more about this. So, and Lisa, if you want to add more to kind of the direction that you were hoping this community conversation would go in, more around that access and like what you, when you're thinking of MedTech technologies, what are we thinking of that could or do provide more access?
Well, I think like any technology, a big part of the power of it is how it's deployed. There's a lot of enabling technologies that have been around for a long time, but if they're not deployed in a way that, people can act, that's really what impacts the access more than anything else. That and the economics, the cost of, can we afford it? I think that one of the biggest things that has been an improvement of access to telemedicine has been the payers being forced to accept it. And that was something that certainly came out of the pandemic, because for a long time, they basically were either not allowing people to do telemedicine in their coverage, or were docking clinicians for fees when they did something on telemedicine versus a live appointment. So I think the economics and the payers always end up in the middle of access, no matter what you do with the technology.
Is that how it has to be? Because I think actually this kind of weaves into what the second question is like, does it have to be that, does that statement have to be true, and what would it look like for it not to be true? That the economics and the payers. What was your statement?
Well, yeah, I mean, I'll give you my personal opinion. If, people say defund the police to drive for better social justice, what they really are saying is divert some of those resources into other ways. I think the same thing is true of insurance companies. I think that they're a big, low value add, heavy cost on the healthcare system, the way our insurance companies work. So I would, I'll give you a very simple example, and this actually isn't MedTech, it's drugs, but it's pharma. So I have a friend who does HR for a big, a good sized company, $100 million company. And they're self-insured, and the insurance company approached them and said, well, we can make your physicians justify using more expensive meds by saying that people have to try the less expensive meds first before they can get the prescription for the drug that the doctor wants to prescribe. So when you think about the cost that puts in the healthcare system in terms of potentially extra visits, prescribing medicines that may not work, extra time for the physician to argue with the insurance company and make different decisions, extra time for the patient, you got to say, is there really enough economic value add? And when my friend asked them the question, they said, well, we've looked at these drugs, so we think we can save you, $70,000. And he said, can you give me one example of another company where you've actually delivered the savings that you theoretically can deliver? And they couldn't do that. So I think that they look often for a way to be a value add that may in fact not be a value add. And they do the same thing with technology. You can't adopt this technology or, that technology because it costs more. And in social costs, it's even more so. For example, insurance companies that don't pay for the use of propofol in procedure rooms, right? Because it's more expensive. It's potentially a little more dangerous. However, in terms of social cost, if you've had propofol for your endoscopy, you can probably go back to work that afternoon. If you have some of the older anesthesia drugs, you're probably lost the day because it just takes a longer time to recover and to feel better.
Social costs. Yeah, well, actually, I feel like just saying insurance company feels very overwhelming to me. So I wonder if we can shift to something more like social cost, or, I mean, does that jab anybody in any way, thinking about social cost? When we think, some of the things that came up for me was like, what does that mean more, social costs in this conversation of healthcare? But also, right, the whole idea of like a better healthcare system involving technology, the whole point of technology is that it makes your life easier and that you don't have to go to the doctor as much. So my understanding of MedTech would be like certain things would actually prevent you from having to go to a hospital, correct? Right, are we on the same page there?
I guess that is one view of MedTech, or if you're in the hospital, that you get in and out efficiently, safely, and.
Right, okay, and that, true.
Which is
As little
the
time spent
reality.
in the healthcare system as possible, right?
Yeah, but I mean, it's like, we don't like insurance companies, but they're part of the equation that you have to deal with, right? And so insurance companies don't care about social aspect. They don't care about quality of life. Like, it does not enter into the equation as to whether or not something is covered. And if it's not covered, then you can't get it adopted. So it can't have an impact anyway. So it really becomes this. Go ahead.
Yeah. They don't care about quality of care unless the breakdown of quality of care costs them more money.
Right.
Yeah, but terrible model. There's no incentive. You just look for the money. That's all it is. All these businesses, they're trying to get their business bigger, not your business, not the health of the patient, nothing. That's the problem.
Well,
I mean, there's no incentive for them to do something different.
No, there's not, and that's where I
It's
hope
like, oh, obvious.
that coming out of, our experience with COVID, does provide a little bit of light, of opportunity. People have had to experiment with new technologies and think about how we pay them, pay for them, because that's how the healthcare system makes money as well.
The costs are merely shuffled around and delayed. I mean, COVID made it quite clear, if you don't vaccinate everybody or a sufficient number of people, regardless of their social or economic circumstance, that costs all of us a larger pool of infected people. I mean, it's just that cost isn't immediate. So I think the way that insurance companies are looking at the costs is too much in terms of immediate short-term feedback loop within a quarter or whatever their unit of economic time is. Whereas some of the costs are longer term and come back to bite them later.
No, I hear everybody talk about the insurance company, but it's not just them. They're looking at the COVID now, they're finding out those drugs like the hexachloroquine, the quinine drug, could have basically worked. That if you treated people early enough, their natural immunity was put them in a much cheaper way to go than waiting for the vaccines. But there was no money in it. And the hospitals, the people developing the vaccine, they all want to make big bucks. You're not going to make it on some old drug. And you're talking about having access. My doctor, when I called up how a test went, they wouldn't even give me the results over the phone. You're talking about telemedicine. Most doctors, they wouldn't. If you go into, they want you to come in for another meeting. And I see this, we're going to have telemedicine. Good luck trying to get the doctors to go along with that.
I actually had an amazing telemedicine help during COVID experience because, so I called my doctor, which I've been for a number of years, had this family physician, and they were like, well, you haven't been here in, 5 years. We're not sure if we could treat you in telemedicine. And I was like, well, I haven't been here in 5 years because generally I'm healthy, knock on wood, thank heavens. But secondly, I could never figure out how to get in to see the doctor because between their schedule and my schedule, working, I just wasn't able to get there. So I would just kind of suffer through whatever illness I had. I saw the doctor the next day. It was a 15-minute appointment, was able to get like an appointment. Once I got through the red tape of like, you haven't been here, literally the next day. And it was an amazing.
And they did it with telemedicine?
And they did it with
Because like I said,
telemedicine.
I would have had gone in for a test And then when I went, I call a week later for the results, they want me to come in for another appointment, pay the old, whatever it was, the $30 copay and everything. I'm like, you just can't give me the results of the test over the phone.
That's
I
interesting.
said, no. But that was one thing that COVID changed, and it said it was trying to pressure more and more doctors to actually
Well, and health records.
answer
And
questions.
health records and access, an earlier panel this week that at Smart Talk, one of the CHOP CIOs was saying that a lot of the hesitation around adaptation of telemedicine was coming from the providers and the doctors themselves to actually utilize it. Now, there was incentive because they were gonna pay, insurance were paying for it. It was able to provide, like, reduce the risk of people coming in and being in a setting where you're potentially exposed to COVID. They might even be now rolling out like some of the pop-up things for flu vaccinations. And so there's lessons to be learned there. But I think from now that you have more physicians actually using the technology that existed pre-COVID, you have more physicians using it. I think especially if we get to the around social determinants of health, if you think about the patient and physician relationship that has to happen, you're waiting forever to try to get into a doctor. Like I've personally also had my kids, I had telemedicine visits over this past year because I was scared to bring them in, but they needed a weight check, they needed to figure out what was happening. So it was really easy. And I think, especially on the clinician to the patient relationship, if you can do more of those touch points, you can also do a lot of preventative measurement. So if you think about, you still have to deal with the digital divide and people don't have access to it. And so that's a tough nut to crack, especially for people who don't have access to it. But as more and more people do have technology, I think the biggest opportunity is that preventative measures for people to prevent hospitalization, to prevent things that before they get really complicated, right? So you think about diabetes and obesity and all the social supports that a physician can provide and a clinician can provide to the patient. To be able to talk through something like that, you really need to go into the doctors, into the waiting room, into the medical room. If you don't have a physical animal, you have those conversations so you can then, as a patient, be more informed about what you need to do. And I think you see some folks starting to do almost like wraparound services with people with complicated illnesses and people who need to talk through how to manage your care. And so that's a one kind of uptick, but there's the digital divide that's a whole nother thing.
Yeah, and I think also something that came up in that is a question that emerges from that is like, how can the telemedicine become preventative and not just this emergency care that we kind of assumed it was sort of used for? It also makes me think about aging in place, which is an interesting MedTech topic, I think, but I never considered until I was like trapped on a bus once with this woman and told me all about her life, and she was talking about how I think her mother was from Norway, and that there's a culture of aging in place, and thinking about how you can use technologies to sort of end nursing homes as they exist today, which is kind of a fascinating. I haven't been to a nursing home in a long time, but I'm pretty sure that I don't want to be in one, and for a lot of reasons. But how can technology help us to preventative care, and then also how can it help us to age better or more safely? I don't know. What do you guys think about that?
Well, it have smart home technology. I think one place, smart home technology to help, monitor the overall environment. I know they've done some unique models, I believe in Amsterdam, helping people age at home. That involve not only, traditional healthcare, but smart home and communities.
It's funny how that doesn't seem like MedTech at all to me, in the sense of how your refrigerator being able to monitor your foods, but it is, right, essentially thinking about how the smartness of your home could be a tool for aging well,
And so all of it is the continued convergence of traditional medical devices, traditional technology, and kind of the digital integration of all those things, and understanding what's regulated and what's not regulated.
Here's the other thing, because, well, what I want to know is, does anybody feel a resistance to this? If I was like, you don't have to go to a nursing home, but your home has to be completely like smartified, whatever the word would be, techified. Does anybody feel like there could be?
Oh, yeah, I can see the government saying, well, you had 3 slices
There's
of
the
bacon.
government,
now
there's the
you can
government.
have the insurance when you
Oh, you wonder why you have high cholesterol. That's what I'm saying.
But, you know, that at some point you want to say, I can live 5 years eating bacon versus 7 years not eating bacon. I choose to eat bacon.
Right,
Why can I not have that choice?
Yeah. And you should eat as much bacon as you want to eat. Yeah, that's, yeah,
But also, doesn't that turn into like, having people with money are like, you know, living longer than people who can't afford a smart
if
home?
we're back, yeah, totally, I mean, that's, yeah, and Lisa, were you gonna add something? I think that's totally.
Yeah, I mean, you know, in my experience, it's for a lot of these major chronic diseases, particularly the ones that are costing the healthcare system so much, like the COPD, diabetes, when they've looked at some of the home issues, it's not about having a smart home. I mean, for example, with COPD, it's about someone going through and ripping up the moldy carpet, which is triggering the COPD exacerbations and hospitalizations. It's, you know, it's money to afford the kinds of foods. It's much easier, it's much cheaper to eat bad things for diabetics, carbs and fatty foods, than it is to get salads, fresh produce and things like that. So, you know, I don't think it even necessarily is a lot of MedTech with the home and the chronic illnesses. It's the having the resources, the wherewithal, the know-how to, you know, just do even some basic things would have huge benefit for a lot of the populations. So.
Yeah, I mean, we are back to number 2, in case anyone was curious, especially determinants of health. But yeah, so I mean, I think that the smart home is really interesting to me because I think it goes back to the same things, which are economics, right? And access. But then it makes me also think about this whole other thing, which was the original thing I said I was not going to do, which is like what is not MedTech and what is accessible right now in terms of like, when we think about devices, it's Fitbits and like the Apple Watches and things like that people are using medically. Like I just heard my friend the other day was telling me about the science of sleep based on like what her, and I don't have one, so I actually don't like totally understand what her smartwatch was like, or her Apple Watch was telling her how she was sleeping and when she was waking up. And I think we would be remiss to not talk about how there is a danger of this, of like more people relying on unregulated devices to make decisions about their health.
I think it's the opposite.
Oh, okay, go.
I'm sorry, but.
No, go, yeah.
I really don't like the medical system. I think most of it bogus. I mean, if you're really, really sick, okay, I've got this disease. The problem is preventing getting the disease. Once you have the disease, oh great, come on, I got a doctor, I got 20 degrees, I know how to treat that disease. And when they give you a drug, it doesn't actually fix it, it just keeps you on a drug. So, really? They go to med school and that's a treatment? Doesn't solve it.
The drugs.
So the thing is to prevent getting that stuff. And that's what these things can do. And I'm doing one myself. I have an app on my phone and it's an auditory thing. I put it on and when I sleep, it monitors my sleep and it tells me, am I in deep sleep, light sleep? Did I wake up? And it gives me a graph and everything. Tells me hours of sleep.
How accurate
So,
are those though?
I think it's plenty. It's like,
the technology
if
is,
it's not perfect, it's
some are more
very good.
perfect than
It's very good, I
others.
think.
Some are more perfect than others, but there
Yeah,
are
but that's not the
things.
point. The point is, it gives you feedback. And I can track it through the whole week. Oh, I didn't get much sleep this week. Maybe I should focus on going to bed a little earlier. Okay? Look, the people have to be responsible for their own health. Oh, I don't have to do nothing. I'll just go to a doctor. That's the problem. People think, oh, I'm not responsible for anything. The doctors know. No, you, the person, has to take action to be healthy.
Well, yes,
Period.
yeah.
That's what they should do. That's why I wanted to talk about number 2, education. The doctor should be saying, hey, now here's an example. I have a toe fungus, right? It's been there for like a year. I'm trying to get it fixed. I go to the doctor And she said, yeah, that's pretty good, you should do it. So she recommends this drug, prescription drug, I get it. It has like 10 pages describing it, and it has so many side effects, like a 3% chance of losing your hearing. I'm gonna take that for toe fungus? No fucking way. I told her, like, I'm not taking that. You're an idiot, right? So I'm looking for my own holistic things that seem to work on that. But that's what the drug, oh yeah, just take this.
Right, because that's your choice.
Super
That's your
dangerous,
choice.
and I mean, just subscribe it, like,
Well, I
yeah.
do think, yeah, and I do think that there's a separate conversation we had about like the healthcare system being drug centered and what the relationship insurance companies have. This has kind of come up. But I wonder, like, to the other side of that, what you're saying is like, how do we think about technology as being helping individuals regardless of whether they have been to medical school?
If it helps
or have
them
any
to think
help-
about their
excuse me,
health
one
and
second, let me
manage
finish here.
it.
So how can we use these how can we come up with technologies like what you're using, like the devices that people are using regularly that are connected to their phones, which everyone has, right? To be preventative, and to, go ahead, Angela.
Well, sorry, I was also gonna say that, I mean, like, there's a lot of apps now and wearable devices that are used for like clinical trials or research studies, and I think that that's like kind of bordering the line on what you're talking about.
Like apps whose data feeds into clinical trials.
Or wearables as well, yeah. Like you have to report something into your phone, so you don't like, if you do a clinical trial, you might forget to write something down, but it's like it'll give you an alert, you have to enter some data.
And there are like portable EKG machines, that you can put on the back of your phone. Blood pressure cuffs, at home things that collect data that you can upload into your medical record and those sorts of things. And so, and those are regulated and audited regularly.
I think the interesting thing is that the technology is evolving. So like if you think about phone text, we've only had smartphones for 13 years. It's not like we've had them forever. And if you think about the early artificial intelligence or, speaking into your phone, it was god awful. Like, if you think of a simplistic analogy, but now think of the power of what that's doing. And so I agree that from my perspective, I'm very curious about my health and want to monitor it. And I don't do the sleep apps because I tried it probably 2 or 3 years ago and didn't think that they were that accurate for me at the time, but that was multiple years ago. And so there's probably an opportunity now, multiple years in terms of the progression of the technology, to say that everybody else who was using it continuously has helped to benefit from it. And I'm confident, very short order, there's gonna be some amazing learnings that we'll get from that. And, things that we don't even imagine that we, couldn't even imagine. Like, what I didn't say, Maya has like a young baby, have you done the Ferber method yet? Like, is your baby sleeping? Because I think there's such importance in sleep. And so just this technology is really fascinating.
Well, the MedTech application, that is that crazy like crib that people spend lots of money on, that does everything like
Right. But it's the 7 axis. What I think is really
The
interesting.
creepy neighbor taps into it and monitors your baby over.
That to me is the scary part of the data, is the data aspect. I mean, really.
I think what's really exciting is that you're getting patients have more data about themselves, that it's empowering them to make choices. And so it's also, but there is an ethical and delicate balance about, there are physicians, there's some, obviously there's, bad apples in any place, but there's physicians who are trained for years, and that relationship is really important. So like, when you're empowering people to make more decisions, but there's this ethical consideration. I think there's legislation, and I can't remember if it's national or state legislation that was being passed, and Tiff, you might know this, about having medical records, like the patient having access to physicians' medical records, like even there are notes that they write down about the patients. And so it presents this thing, because if you think as a clinician, you're trying to understand the patient, you're just trying to understand what they're presenting with. What are the ethical considerations of opening and everything up? Like, should the patient have access to everything? This also came up with like, the genome mapping, like would you want to see what you are you might be able to have, what genes might be able to have. Oh, okay, I missed that whole thing, but like, there's that balance of like, respecting the professionals of the clinicians and their judgment, but also equipping the patients to question that, because they're not always right. And there's there's issues that come up, but like, how do you make sure you have an informed public to advocate for themselves, for their community? I think that's the silver lining of this, is that it's being able to question those decisions. It's being able to say, hey, this has this side effect, are you sure this is what are my risks? So you can assess yourself for yourself and make that judgment call, and you can have that choice to make that.
Yeah, I think also that gets back to what was being discussed before in terms of like individuals being able to participate in their own healthcare and not having a system where you're just going to your doctor and being like, this is my problem, how can you fix it, right? But I mean, it is interesting to me to keep going with that and thinking health records is one. I think it's amazing to be able to see and remember like when you got your tetanus shot, like what your blood work was, because nobody remembers all the words, and all the letters, and it's helpful, I think. But then there's also, when we're thinking about access in a little bit of a different way, like my friend who was talking about sleep, like she maybe would not have been talking about sleep. I think her own patterns are how it connects to her whole life, which obviously relates to everything that she does and feels every day. And how do we think about either what regulation looks like for these different consumables, and then how you can interact with your doctor about these things without it just being a shutdown, which is like, I'm walking 6 miles a day. Why is my blood pressure? I don't know. Why is my blood pressure so high, right? Something like that. I don't know. I guess it kind of comes back to that, like regulated versus not regulated is a really interesting dilemma.
So it's interesting, do doctors, and I don't know the answer to this question, do they appreciate the unregulated technology? So like, if you go in and say my sleep app is telling me this, what are the doctors prepared to deal with that? And maybe it's probably some are and some aren't, but like, is there something from preparedness that they need to be able to be doing?
Yeah, I mean, I think they're not homogenous or monolithic. They're neither are health systems. I mean, for example, access to medical records. I can log on to the gateways of my physician's office. I can get all my medical records. If I want my test results, I get my test results. I can either log in and get them online, or I can call the office and get it from the nurse. I think the same thing with doctors. I've seen some that are big on supporting use of supplements, on supporting use of things like acupuncture and other integrative therapies that are very open to data from the wellness apps. And, certainly almost every physician is up for people. These are questions of personal choice, and you can find physicians that match your philosophy and your approach to healthcare, which doesn't necessarily speak to the issues of access in the overall health system. It's kind of more of a personal relationship, you can shop organic food or get,
Well, yeah, so that's interesting because with like a lot of apps, like, I mean, even just like thinking about the Apple Watch and things like sort of those healthcare apps, like the suggestion, I think is actually where it gets tricky. Like when you have a device that's offering you suggestions based on the data it's collecting on you. I mean, that's where to me, a question about regulation gets more interesting. Like, who wrote that software that says maybe you want to sit down right now, right? To me, that's like who was qualified to make that suggestion, and maybe the qualification is less about regulation. Yeah, I mean, when you talk about software, yeah.
Well, if I'm thinking, taking a big step back, if I'm thinking about that is going to be part of the business, right? And if for them that company, that technology to be able to raise money and successfully enter the market, it's based on there's gotta be some there from their scientific advisory board, studies that they may reference, things that they may track. Part of that is like getting to the point where you're launching a massive technology project. Kind of works under the assumption that there's some there.
I don't think that's necessarily true. I think a lot of those apps set things up to be programmable for just that reason, because they can't practice medicine. They can't make a recommendation. They can say, hey, our default is every 2 hours, we'll ping you to, if you haven't moved in 2 hours, we'll ping you to get up and move. But you can change that to 3 hours. And we're not saying that 2 hours, that there's going to be any consequence if you go 2.5 or 3. I think the regulations, even for those wellness apps, are pretty clear. You can't practice medicine. You can't tell someone what's healthy for them, but you can sort of say, hey, here's the averages, here's the benchmark, here's the default. And most people just leave it there. But like
If I'm making the assumption that 10,000 steps a day is the general rule of thumb, right? That's not arbitrary, that's based on.
Well, actually, that is.
It is
completely
arbitrary.
There was a Japanese company that made pedometers where that was the maximum, whatever that pedometer could measure. It's completely out of nowhere, that 10,000.
It's totally arbitrary.
So is it hours per day? I mean, I see all kinds of hours per day, distance.
Yeah.
When
All
I
of the data said if you move more, you're healthier. That's about the extent of it. You know, it doesn't, there's no threshold. There's different studies that have different numbers, but it is arbitrary.
There's a huge gap between just sitting in front of the TV 24/7 and running a marathon. But the benefit in even just walking 5 or 10 minutes is underestimated by saying you have to walk 10,000 steps.
Right.
A lot of these questions being about trust, and do you believe it? Do you act on it? Do you use it? Is it useful? And everyone goes about doing that differently. Is there some tech that can tell you which tech you should trust?
This tech would be right for you based on your level of trust. Yeah. Yeah. Do you want to say any more? No.
And there's privacy issues with this stuff too. I mean, Google bought Fitbit, and they're not doing that out of the goodness of their heart or promoting health or any other reason. And this actually happened, I believe, that soldiers were wearing Fitbits, and so foreign entities could say, "Oh, everybody's out on patrol now." So yeah, it's all.
Yeah, well, this goes back to somebody brought this up, like when you have data being the central, like the common variable between all of these technologies, then there's a lot of distrust in like big data. And I think, you know, it's interesting to, like, I don't know with these regulated or unregulated devices, if all that data is, what is done with it, right? And like, what are the fears around that? Goes back to the kind of trust thing. Like, are you fine with your sleep data going into a great pool of data to potentially create new devices to sell back to you about sleeping better? That's how it all works.
I think it's more likely that somebody will look at this Fitbit data and say, "This guy never moves. We can sell him more junk food." So let's push more junk food ads.
And they can though, probably, right? You're the baker guy. Yeah.
Bacon ads.
So I think that the people need to be more aware that they should own their own data.
Absolutely.
That's so, I have very different feelings than you about this, which is good that we don't have the same feeling. Because this came up in the cell and gene therapies too, where about possessiveness and ownership over personal data, your physical body, right? The first question I was thinking a lot about how, like, when you an organ donor, you know, are you relinquishing the ownership of your organ? Like that we as I think this is a very probably an American thing to have this sort of fixation that everything I do, say, and am is mine. And that data really pushes that and questions that. What about is your the data of your behavior, should you have ownership over that? I mean, if you think that well, do you?
Advertise it so they can use it, research like Apple stuff. They can do studies now with like 300,000 clients or test units, where before you do a study that big, millions of people, they don't have the money, so they can do that. But the data is not attached to you, it's just collected, it's not attached to you physically, not like identified. So, fine, let them use my sleep data, I don't care. So that's the point.
Right, so there's your opinion. Some
But
people
even if
say
it was, so
I'm trying to understand what you mean by ownership of your body. Suppose like George, I know you can donate this part of your liver. So suppose George donates part of his liver to somebody and they find out that he's got a particularly healthy liver. So they say, why don't we, we got the technology now, why don't we grow like 1 million of these? And some company grows up, the next thing you know, they're the Google of artificial livers, right? Using George's
If they can
liver.
figure out how to grow
George
a
gets-
functioning liver, amazing.
But
That's
George
amazing.
gets nothing out of it. It's like, well,
wait a second, where's your royalty for that?
So that's, I mean, but we're back.
because they found that out with certain things, that some people are particularly good for something, but they never got anything that the hospital developed.
You can
from
take
it.
this to a next step and say, if you donated your, on a cellular level, right, that was the first question, if you're donating stem cells that are for research around actually being able to develop a fully functioning liver from stem cells, at some point, if that works out, is that scientific discovery, should you get paid for something like that? Should you get a free liver? Like what, I don't have an answer to that. I think it's
That's what I'm
really
saying,
interesting.
like,
A lot of
that would
pieces
be,
come back to us.
like, if your stem cells were particularly good at growing body parts, it's like, well, you should be getting some of the money from that too.
See, I completely disagree with that, but I'm glad that you have a different opinion than me. I mean, because I think like if we can make fully functioning organs and we can eliminate an organ transplant list, yeah, great, let's do it. I don't need any money. If it isn't saving the lives of thousands of people enough compensation?
And then somebody else saving the lives of other people, and somebody else makes billions from the data they got.
Yeah,
from your
that's
your body
that would
part.
be that's our spin-off community conversation, I think. Because I think we're getting to.
Well, there's been cases, I'm not familiar with the details, but something like a researcher using a very particular genome of a person and then patenting it.
Yeah.
That seems rather bizarre to me, going the other extreme.
Patenting the genome?
Yeah, that particular gene sequence, whatever, I forget the details.
Maybe we can talk about this after, I'm not familiar with that, but I'm curious. Does anybody who didn't get to talk as much or have anything else to share in thinking about these things in our last few minutes? We just arrived, so.
Trying to figure out where you guys are.
Well, this is our meandering discussion sort of around starting sort of MedTech and different scenarios to consider in terms of a lot of it came up. I think I can recap a little bit about access, both like how does telemedicine provide more access? Is it authentic access to everyone? How could it potentially be utilized in a better way? We talk about how telemedicine could be a preventative, that a lot of people kind of can use it instead of just for emergency care in a pandemic time, but how can it actually be used preventatively, which is a larger conversation to prevent, you needing to rely on medical devices in the future. You can check this out. Aging in place, smart homes, really interesting health records as being like a MedTech topic that allows people more ownership of their own health. A lot about data and wearables and we have these hot words like insurance companies and drug center and things like that, and thinking about basically how our society is set up and does it have to be set up that way? And then you have this whole other, what do they say? It's like the other force, which is, technology, and how will technology, is it intersecting with medicine, and how will it continue to be if we had a choice, what we want that to look like.
So are you talking about this specifically in the context of clinical trials or in general?
No, in general. Angela brought up the point about how like data collection for certain apps, qualified apps, right, could be used for like for research and trials, because it did come up that you have this potential for so many people generating data to be used for like much more representative studies, you know, and samples. But yeah, that's generally where we went. We're almost done this time, but that's generally where we went. We're gonna do this again in a month. What's the topic? I don't even know. We haven't decided yet. Yeah, we haven't decided yet, but so the whole point of this community conversation is that we talked about a lot of things in an hour. Thanks for sharing your thoughts and like really getting into some things. And then it's done. It's done. We did what we could in an hour, and you can go and think about these things again. But next month will be completely different.
Oh, we solved health code.
Just put a bow on it.
So next month our theme is mindfulness. We haven't like decided where we want to go with that.
Yeah. So
That could be a lot of things.
my name is Maya. If you have thoughts on mindfulness and community conversations, you can find me on the Science Center website. I run the First Hand program, so you can find me through there. I mean, my last name is Highland, but I'm not going to spell it for you, so we can just go from there. But thanks for joining in person, and people out there, thank you for being so accommodating to this new environment here. So thank you, everyone.